Hello dear students, I hope your preparation is in full swing for the upcoming INICET examinations. So how are you planning on approaching these exams with, let's say, hardly 7 to 10 days left? I honestly believe revision is the key. Okay, revision is all that's going to be needed. Alright, don't bother trying and reading a new topic which you have not read about, especially at this point of time. Okay, now when it comes to the exam per se, please read the question carefully. Spend an extra 10 or 20 seconds if necessary, because one word here and there can change the scenario of the question completely. If the scenario changes, so will the management. And we all know that wrong answers carry negative marking, so that will definitely play a role in your scoring and your ranking at the end of the day. Now, I also want you guys to look up all the topics where the previous year questions have been asked from, with a small twist, because everyone will be doing that. That small twist is that INICET has a habit of asking 1 or 2 bouncer questions every year from some weird topics which nobody would have heard of and nobody would have thought of as well. Okay, now you don't go wasting your time sitting and reading those weird topics, because those questions will never be repeated. Instead, concentrate on the commonly asked topics. Like for example, breast and thyroid. Almost certainly you will have 1 or 2 questions from these topics. And with regards to these 2 organs, majority of the questions are from their respective malignancies like breast cancer and thyroid cancer. So please revise them well. Now moving on to topics such as nutrition and trauma. Okay, here you're going to get case-based scenarios. They'll give you a case scenario saying patient has sustained trauma, he's come to the ER, pulse is so much, BP is so much. What is your next line of management? So all I want you guys to do is go through your respective flow charts. Okay, make a flow chart. If the patient is hemodynamically stable, what you're going to do. If the patient is hemodynamically unstable, what you're going to do. What is the next line of management, so on and so forth. So go through your flow charts again and again. If you don't have a flow chart ready already, please spend about half an hour and get it ready, because I honestly think it's worth it. If you have your flow chart ready, you will be able to answer scenario A, B, C, D and E quite comfortably. Now moving on to topics such as upper GI tract. Please go through endoscopy images and barium images of topics from stomach and esophagus. Okay, you will have questions from them. On the other hand, in the lower GI tract, the tricky part is to try and identify the various benign anorectal conditions. Okay, like fissures, fistula, hemorrhoid, rectal prolapse, sometimes even volvulus. If they don't ask you the image per se, they might ask you the radiographic image of that particular condition. So please go through them. And last but not the least, general surgery topics, wound infection, wound healing, perioperative care, topics such as minimally invasive surgery. They are bound to have 1 or 2 questions, and trust me, this is the game changer. Those who get these answers right will definitely have an upper hand over the rest of the crowd. Okay, now at the end of the day, all you have to do is concentrate for those particular 3 hours that you're in the examination hall. Okay, those 3 hours that you're going to spend there are basically a culmination of all your efforts over the last few months. I wish you guys all the best, and I'll see you on the other side.